So the first exercise is the shoulder external rotation with a pulley machine. In this exercise, the shoulder is engaged as it allows for rotational movement, being external rotation in this case. The joint action occurring is external rotation, and the muscles engaged in this exercise are the infraspinatus and the deltoid and the pectoralis muscle, which helps with stabilizing the shoulder joint during this movement. In the video, the exercise was done incorrectly. When done correctly, the concentric phase would occur when moving the arm away from the body, and the eccentric would occur when the next exercise is the lat pull down. Here, the participant is not using the right bar, and they haven't set up themselves properly by leaning themselves slightly backward, lifting up their chest, and then remaining in that fixed position while doing the exercise. But here the joints involved would be the shoulder joint, elbow joint, and scapulothoracic joint. During the downward phase of the movement, the shoulder joint actions would include adduction and horizontal abduction. For the elbow joint, it is flexion, and for the scapula, it is downward rotation. In the upward phase of the movement, the shoulder does abduction and shoulder horizontal adduction. The elbow does extension and the scapula does upward rotation. The muscles engaged in this exercise are the latissimus dorsi, teres major, and the posterior deltoid. The concentric phase occurs when the arms move down and the elbows flex, while the eccentric occurs when the elbows extend and the arms are above. The next exercise is the push-up. The joints engaged during this exercise are the elbow, shoulder, and wrist joint. The joint actions during the upward phase are shoulder extension, elbow extension, and wrist extension. The joint actions that occur during the downward phase are shoulder flexion, elbow flexion, and wrist extension. The muscles engaged during this exercise involve the pectoralis major, the triceps brachii, and the anterior deltoid. The core muscles and quadriceps are engaged to maintain the body's alignment. The concentric phase occurs when the body is pushed away from the ground, while the eccentric phase would occur when the body is. The next exercise is the squat. The joints that are involved in this exercise are the hip joint, knee joint, and ankle joint. The joint actions during the squat in the downward phase are hip flexion, knee flexion, and ankle dorsiflexion. During the upward phase, the actions are hip extension, knee extension, and plantar flexion. The primary muscles worked during the squat are the gluteus maximus, quadriceps, and hamstrings. The core muscles and calves in this exercise help to maintain the body's alignment. The concentric phase is when the participant is standing up straight and there is no knee or hip flexion. When in the downward phase, or the eccentric phase rather, the hip and knee. The next exercise is the hip abduction. During this movement, the only joint that is active is the hip joint. The action is hip abduction. The primary muscle involved in this movement is the gluteus medius, which contracts concentrically to lift the leg away from the body. The other muscles involved in this exercise are the gluteus minimus and the tensor fasciae latae, which assists in the movement. The concentric part of the movement happens when the leg lifts. And lastly, we have the Russian twist with a medicine ball and with the feet in the air. The joints involved in this exercise are the hip joint and the spine. The joint actions here involve the spine performing a rotation and a slight flexion, while the hips will remain stable in a flexed position due to the feet being in the air. In this movement, the obliques contract to rotate the spine. The hip flexors and the lower back muscles contract to maintain the flexion of the hip.